Good evening, everybody. I would warmly like to welcome everybody to this webinar. Today we will be discussing the management of urinary tract infections at home without the use of antibiotics. So, as I say, may I please ask throughout the webinar if we could please mute ourselves and turn your cameras off. And if you have any questions, please write them down. We will have a Q&A session at the end of the webinar where you will be able to either post your questions in the chat, or you will be able to ask the questions as they come up. Yes, I will do a brief overview of the agenda before moving on to the introductions. So we, as I said, will have a question and answer session at the end with our speakers. So place your questions in the chat, or take note that you can also raise your hand at the end of the session, so that we avoid any disruptions throughout. Next. So, just a little bit of introduction of myself. I'm Krista Blanche. I am a registered nurse. I have done a BCo Honours in Advanced Nursing Science Perioperative Nursing Care, postgraduate, and I am the product manager for Sonoma at New Angle Medical and the Surgical Wound Care Division. So, yes, I think we can go to the next slide. So firstly, before we get to speak about urinary tract infections, I would actually like to speak about hypochlorous acid and how Sonoma came into development. Um, and they actually developed the world's very first stable hypochlorous acid solution that changed the landscape of wound healing and infection control. Absolutely. So Sonoma bottle hypochlorous acid is actually produced naturally by the body as well when you have injuries to fight infections. Next. So when we look at microdacin 60 or at Microdox, it has a triple mode of action. It's got an antimicrobial function that reduces the microbial load and prevents and reduces infection in the area where it's used. It's got an anti-inflammatory action, so it reduces histamine release. It is regenerative, so it promotes fibroblast migration and increases capillary perfusion. And all that basically means is it promotes healing in the end of the day. So the kill time of microdacin, and it kills 99.9% of bacteria, and within 30 seconds, it actually starts acting. These are just a list of the microbes that it's effective against. It expands over a whole spectrum of microbes. The success in hospitals and clinical environments worldwide of Microdacin 60 as a wound healing solution has led to the development of Microdox 60 that we now use for the treatment of urinary tract infections. So, without any, so when we look at Microdox 60, an electrolyzed bladder solution, it is a solution that contains a superoxidized water with sodium chloride, which is normal saline, and then it's got hypochlorous acid, which is the active substance that actually fights the bacteria, reduces inflammation, and promotes healing. And then the sodium hypochlorite, which is just a buffer. And yeah, without further ado, I think that basically gives us Microdox. I would like to introduce Ari Seirlis. He's the former CEO of Catheter-Association and the current member of the Presidential Working Group on Disability. And I would like to introduce him as our first speaker. The floor is yours, Mr. Seirlis.
Good evening, everybody. It's a great a pleasure for me to come and tell you about Microdox 60. Where have you been all these years? But I'll get to that a bit later. First of all, it's really good to see a lot of my friends and colleagues and fellow persons with spinal cord injuries present here today. So what I'm going to tell you is not anything that you probably don't know in terms of suffering those unintended consequences of spinal cord injury, and that is mostly bladder infections, and then, of course, I'd say secondary, being able to manage our bowel in a way that allows us to stay mainstreamed in society and live a normal life. So if you just read my introduction, our injury changed the rules, but it doesn't get to dictate the game. It's time to take control of our bladder health from the inside out. I've been on a journey for 42 years as a person with a spinal cord injury, and there's a few people here that have been on a journey much longer. But it doesn't matter. We often suffer the same symptoms of feeling that slight headache, getting that bead of sweat on our brow, and by now we all know what's happening is that we're about to get a bladder infection. The unintended consequences of spinal cord injury really are what affects our daily life more than our mobility. And when people see us using wheelchairs, they have no idea about the unintended consequences within which we live. And I have been through a number of bladder management routines over the decades. And now I think I've hit the sweet spot in my particular case with using intermittent catheterization, using a single-use catheter, and then supplementing whenever I feel adding to my routine is to use Microdox 60. It's been a game changer for me, and let me explain some of the reasons why. Next slide, please. So in the Quasar stable, we have asked our members to become advocates for their own rights in terms of bladder management, especially to reimbursers. So if you're doing intermittent catheterization, we must refuse to reuse catheters. We must ensure that we use single-use catheters and make sure that they're reimbursed. We've been on this journey for almost a decade now, and I'm hoping that everybody that does intermittent catheterization, if you're not on single use, you're welcome to contact Quasar, and Quasar will help you with the lobby to get it reimbursed. I mean, it's inconceivable to think that if you buy a Coke in the corner cafe, you get your can of Coke and a straw, that you would, at the end of the day, throw your can away and keep the straw and put it in your pocket and reuse it. So why is it imposed upon us with the catheters for us to reuse catheters? It just doesn't make any sense. And in fact, it's against our human rights. So here we've got our bladder management right if we have, and if we haven't, then Quasar has a way to assist you. But there is still a risk of bladder infection. And I don't have to tell you, but let me share some information with you of how it really affects our lives. Next slide, please. The 7 menaces of UTI. You know, autonomic dysreflexia is probably the worst of the lot. Not only does it give us risk of stroke, severe headaches, and I'm talking about pounding, excruciating headaches and pain, profuse sweating. Next, please. We need to protect our long-term kidney health. We will often get kidney infections. As a result of that, we get kidney scarring, and as a result of that, we probably end up with kidney stones. We need to safeguard our skin integrity, increased risk of pressure sores, immobility from fatigue, delayed wound healing. Next, please. We must avoid systemic health complications. We could easily get urosepsis. We become resistant to some antibiotics. and our gut gets tired of all of the medication that we take to get rid of bladder infections. Maintaining physical independence and mobility, you can all attest to the fact that if we have a bladder infection, we get profound fatigue. Next, please. It affects our mental health. And I attest to the fact that you get brain fog, cognitive decline, increased anxiety, and who knows, even depression. And then, of course, in terms of social, financial, and lifestyle preservation, we must work or school. It's a financial strain for us to have bladder infections. It's an interference with our social life. It disrupts our travel if we do travel. It has an impact on our intimacy. It's a strain on our caregivers, and we have frequent hospitalizations as a result of bladder infections. Next, please. Here's a mantra to remember. By combining the gold standard of single-use intermittent catheterization with the advanced antimicrobial defense of Microdox irrigation, you're actively disrupting bacterial colonization, significantly lowering the risk of infection and taking the most proactive steps possible to maintain a healthy and resilient bladder. Screenshot this mantra, or if there's any slide to remember from my presentation, please, this is the one. So on a personal journey, from the time I started using Microdox 60, and I'm sure the doc and the nurse will tell you about the right dosage to use, it has changed my lifestyle. I used to say I never get bladder infections from using single-use catheter, but I'd have to step back and say I've often been on the brink. And so I chose a routine of irrigating my bladder with 50 to 60, maybe 30, 40, 50 to 60 mils, a choice of mine, occasionally, well, quite regularly, to ensure that I don't even have any symptom of a bladder infection. Microsoft belongs in my ammo belt. I take it on holiday. I've got Microdox in my car. I've got it everywhere. Wherever my wallet goes, which means I'm on the go somewhere, I take my Microdox with me. And it's kicked any sign of a bladder infection to me out of the park. So I have no doubt that a number of you that are using the product would say the same. And if you're not, it will be a game changer and a life changer for you. And I can assure you that your bladder infection frequency will reduce tremendously if you get onto a Microdox program. My next slide, please. So there we are. There we go. With my last little quote, kom ons klap daai ding. Get onto Microdox. I'm a user regularly, almost every second day, and it's been a game changer. And I'm really, really glad to share this information with you. It's not rocket science. It's just a new intervention, as I said right in the beginning. Microdox, where have you been? So you're in the market now, and thank you very much. I'll be your customer forever. So with that, thank you very much.
Seirlis, thank you very much for your contribution. That was fantastic. We would like to introduce our second speaker, Dr. Virginia Wilson. She's the Vice Chair Medical of the Spinal Cord Association of South Africa. She's the Chair of the South African Society for Physical and Rehabilitation Medicine Fellowship, Advisor, International Rehabilitation Forum, IRF. So with no further ado, Dr. Wilson, the floor is yours.
Thank you very much, Chris, and a warm welcome to everybody who has joined us this evening. I see some very familiar names on the list of attendees, which really gladdens my winter heart here. Ari, thank you. You have said it so succinctly, and I hope that what I say is going to add to what you have said. So everybody calls me Dr. V. And can I have my next slide? So Microdox in my practice, the most important thing is to understand a little bit of how things work inside in the urinary system. So blood comes from your heart with its oxygen and all the nutrients in it, and it goes back to your heart with the oxygen taken out. Hopefully you've breathed it in through your lungs. So there are big vessels supplying both your kidneys on each side of your abdomen, and then the kidneys do an amazing filtering task and take out everything that's not going to be good for you in your bloodstream and send the urine down the ureters on either side to your bladder. And then under normal circumstances, when you do not have a problem with emptying your bladder, you pass it out through your urethra. Next slide, please. So one of the fundamental things to understanding what I'm going to tell you is to really understand about pH. Some of you will have recollection of learning about this at school. And if there are medical colleagues, you don't have to listen to this. But just know that the things that are nice, like water, is very neutral, as you can see in the center of your screen. Nice and green. Milk is also neutral. Coffee's neutral, more or less, and good for you. So as you go, let's look to the right of the screen. Everything to the right, getting blue to purple up to 14, is what's called alkaline. And if you look at the top layer, you'll see stomach tablets. So that is your Alsanic or your Gaviscon, whatever antacid you want to neutralize the acid in your stomach when you get reflux. Baking soda, and you'll see also that bleach is very alkaline. Then if you look towards the left, the very far left, top left, there's battery acid. We don't really want to have anything to do with that, hopefully. And as you will see, the next one along is stomach acid, to show you that the acid in your stomach is extremely acidic. Things that are good for your bladder are lemons, vinegar, and tomatoes. I'll say a little bit more about that, because if we maintain, if you have a neurogenic bladder dysfunction, that's the official term, or you can't pee, that's the unofficial term, you want to try and keep your urine a bit acidic, because it helps to inhibit bacterial growth in your urine. Next slide. So as I've just said, you want to maintain what's called a low pH if you can, keep your urine acidic. Please, please, if you have a bottle of citrus soda in your bathroom cupboard, after this webinar, you take it and you throw it away. You can give it to a gogo like me, because we do tend to get bladder infections as we age. But for you, if you are using any form of catheterization to empty your bladder, you never ever take citrus soda. It should not be your go-to product at all. I've already emphasized how to keep your urine acidic, you need to eat certain things in your diet, please. Tomatoes, oranges, red and green peppers, broccoli, strawberries, melon, potatoes. Those contain good quantities of nutritional vitamin C. That should not be difficult. Cranberry is also a useful adjunct. It's expensive though. You can buy it in dried form, you can buy it in juice form, you can buy it in tablet form, but be very careful. Cranberry juice contains a lot of sugar, and most of the products we get on our shelves are not pure cranberry juice. If you do find a pure cranberry juice, it's usually from the United States and costly. I think it's okay to use it if you want to, but I would rather go the food and possibly orange juice route if you can. You can also supplement your yourself with vitamin C tablets. You can take up to 2 grams a day. That would be a gram in the morning and a gram in the evening. The advantage is that vitamin C is very cheap. You can buy a large bottle at any of your local pharmacies. So there are ways to do this that are not expensive and that are easy and straightforward. Next slide, please. This is your friend. It's a glass of water. That's fundamental to your own personal management. Next slide, please. So when we look at fluids that you are drinking on a daily basis, water gets a big tick. Please, please avoid fruit juice. If you do want to flavor your water that you drink, just put a little bit in your water bottle. Avoid fizzy drinks because they contain usually a lot of sugar, and the gas is not good for your bowel. That's definitely a very good reason. Alcohol, although it tastes lovely and delicious, if you're an alcohol drinker, is not a great idea. On occasion, of course. I think, we have to be human beings. We do eat and drink things we sometimes shouldn't, but as long as it's not on a regular, excessive basis, that's fine. Please drink a minimum of 2 liters of water from the time you wake up to the early evening. You don't have to do the 2 liters over 24 hours. When you go to bed, drink only if you're thirsty. So keep that bottle of water to your bedside, and if you wake, whether you need to turn or catheterize or be turned or be catheterized, take a sip if you're thirsty. Otherwise, it's do that 2 liters from the time you wake up to the early evening. And that's particularly important for those of you who do intermittent catheterization, because you want to minimize how often you are waking at night to catheterize. Be careful, and people don't tell you this, be careful of black tea, because if you're drinking a lot of black tea, that promotes the formation of bladder or kidney stones. Next slide, please. So when I wrote this, what is a biofilm? It makes me think of a bioscope. There we go. That shows you how old I am. So a biofilm starts developing when you get a layer of bacteria or other microbes, i.e. viruses or anything like that, that grows on and sticks to the surface of a structure. And the surface and that structure is your catheter, whether it's your intermittent catheter or your indwelling suprapubic catheter. So it can cover natural surfaces such as your teeth. As you know, when you wake up in the morning, sometimes if you run your tongue over your teeth, you feel that slightly sort of slimy feeling, particularly if you didn't brush for the dedicated 2 minutes the night before. So biofilm can also grow inside or on medical devices, such as catheters or an artificial joint. So your catheter's got, don't forget, it's not just the outside of the catheter, it's the inside as well. And the bacterial biofilm can form particularly in chronic infections. If you have a decreased immune system, or if you've had a lot of antibiotics and you've got antibiotic resistance, and there's a lot of inflammation going on, and there's tissue damage and all that sort of thing, and we don't know, us doctors, we don't know what is going on with you. So this is a biofilm may be helpful sometimes, but where you have bladders that don't empty naturally, it can be a very big problem. Next slide, please. So that's why, one of the reasons why I started using Microdox in my patients. A bit like Ari, it was a light bulb moment for me too. So I worked for many years with a urologist who did all the urodynamic studies for my patients. And he actually recommended it to me. When I went to consult him about all sorts of things that were bothering me, that were regarding my patients. And the other reason was because there was increasing, and there still is, it's a major, major issue, is antibiotic resistance. So if you have recurrent infections, what happens is you get a course of antibiotics, and then 2 or 3 months later, you have another infection, another course of antibiotics, and eventually you may end up not being able to have an antibiotic because your urine has developed resistance to everything except nasty intravenous antibiotics. And it's seriously scary. You just can look it up on whatever internet site you use. Antibiotic resistance is really a huge problem in the medical environment. So I always tell my spinal patients, sorry to say this, you've got a bacterial stew in your urine because you don't empty your bladder naturally and normally and voluntarily. So to me, the clinical evidence was compelling. And as I learnt about Microdox, I realized it was very safe, it was easy, and it was cost effective. Next slide, please. So it's simple to use. Ari didn't go into the details, but wash your hands. I mean, you wash your hands with any intervention with your bladder. You empty your bladder, whether if you are using intermittent, you take an intermittent catheter and drain your bladder. You take up 30 mils. Ari used slightly more, but the average is 30 mils, using a catheter tip syringe. And so you pop the catheter tip syringe into your indwelling catheter or your intermittent catheter, and you insert the 30 mils into your bladder and leave it there for not more than about 15 minutes. And you can repeat this if there's a lot of sediment. That's the medical word. And it looks like pieces of sand or fluff in your catheter tubing. You've probably all seen that over the period since you've been having to use a catheter. You can warm the Microdox slightly if it makes it more comfortable for you. And if you're on antibiotics, you can still continue using it. That's really important. You don't have to stop it just because you're on antibiotics for any reason, bladder infection or any other reason. Next slide, please. So how often? Well, Ari described quite clearly to you how often he uses it. So the nice thing about Microdox is you adapt it to your individual situation. Maintenance is usually maybe once per week or twice per week or 3 times a week. It's entirely up to you. You can judge it by the clarity, how clear your urine is, or the color of your urine, or if you're worried in any way, there's a lot of sediments, you up the dosage. And if you suspect you're developing an infection, definitely immediately, twice daily for 3 days. Now, the signs and symptoms of an infection differ between various people, but you can feel sweaty, you get a headache, you have a temperature, you may have nausea, and particularly you may have an increase in spasms, and you may have an increase in neuropathic or nerve pain. Always be alert to those specific symptoms. And just remember, you can't harm yourself by using it. If in doubt, ask your medical consultant, ask a friend, ask Quasar. There are plenty of people to ask. Next slide, please. So I just want to give some of my personal results with my patients. Mr. C is a paraplegic. He had a shocking time. Every year he had up between 8 to 10 infections. He had a very difficult funder. He had time off work. He was very depressed. Started him with Microdox, and since then he's had an average of maybe 1 infection per year. I mean, he said it was life-changing for him. Then there's Ms. M. She's a quadriplegic with a suprapubic catheter. She had frequent infections with increased spasms. And this is a bit of a slightly out-of-date slide. No antibiotics required now for a year. both patients are very positive with their experience. Just to add in, currently I'm looking after in a long-term care facility, a quadriplegic with a suprapubic catheter, and just 2 weeks ago, he had a lot of sediment and he was getting a headache and his blood pressure was going up. So I said, right, start the Microdox, please. They started it. They changed his catheter. We never did anything more. We never sent a urine to be tested. It's all settled down. So definitely, I have positive proof of what the use of Microdox has done in my practice. Next slide, please. I just want to make, before we go on to Sister Mac, just a comment that if there are medical colleagues here on this webinar and you want to ask me any medical questions, please do it via Krista Blanche and New Angle. I'm happy to, they will direct them to me. And that this webinar is actually aimed at the user, the consumer, the person with neurogenic bladder dysfunction. It's not primarily aimed at medical colleagues. Thank you very much.
Thank you very much, Dr. Wilson. We really appreciate your fantastic presentation. I'm sure everybody's learned quite a lot. I have actually picked up quite a few things from your presentation. So thank you very much. So without any further waiting, I shall introduce Sister Beth Mack to you. She's a registered nurse, a registered midwife, decades of experience in wound care and IV therapy and platelet therapy. So without any further delay, Sister Mack, you are welcome to take the floor.
Thank you, Chris. Can you hear me at least?
Yes, we can.
Yay! Right. Good evening, everybody. This has been a very interesting little webinar. And if we look at how much money UTIs take up on medical aids and medical funds, because we know that about 40% of healthcare benefits go to UTIs, and about 80% of that is pretty treatable. And we get to see these patients all the time, and it's really desperate to see a patient that has repeated UTIs and just how debilitating it can be. So whether it's a paraplegic, a quadriplegic, or just a patient with really poor bladder history, I like to try and make my patients independent. As I hear Ari was saying, and it's just great to hear a patient that is able to manage his own treatment. So if we can go to the next slide, please. So we've been through what Microdox is, and we can use it with or without antibiotics. And as we've already mentioned, it is safe to use daily or less frequently. And it's very easy for the patient to use it. And one of the good things is I've had a couple of patients from rural areas where they don't always have access to clean catheters. So some of them are forced to use their catheter 2 or 3 times, and some even more. And this is not an ideal situation. But the fact that the patient can actually also clean their catheter with the Microdox is a great one. And it is non-toxic, and we can use it as the patient or the healthcare practitioner sees necessary. Next slide, please. I like it because it's non-irritating, and while you're busy doing an irrigation or a washout with the Microdox, you can almost see the patient relaxing, and they will say to you, sure, what relief that is. And for me, it's probably like having an itch you can't scratch. And for patients with recurrent UTIs, this is their solution to the not being able to scratch something. It's biocompatible, and as Dr. V said, it is pH neutral. Next slide, please. Cost effectiveness is imperial today. You know, a lot of these patients have many other things wrong. They could be on hypertensives. They're obviously on cardiac medication, and the medical aids do give patients a hard time. I use it not only in urology, but I use it very successfully in wounds. And I get some really horrible, nasty, fungating wounds. And where I've got wounds with sort of bacteria and fungi, this is a huge answer for us wound care nurses out there. It kills bacteria virtually in 30 seconds. And as Ari said, he uses up to 60 moles. I normally start with 30. I get the patient to also move around, so the bladder's been really well coated if we haven't got sufficient in. And the patient will also tell you, they know their bladders better than we do, but the patient will also tell you that they can take a little bit more. So it's important for us to listen to our patients, because these are the people that are living with this condition. I love the fact that it takes oxygen to the wound, but the biggest factor for me is killing off that bacteria biofilm. And biofilm you get to see very often in wounds, especially on superficial wounds. But as Ari and Dr. V also said, you don't get to see biofilm in a bladder because we don't have X-ray eyes. So having that peace of mind in using a product that will kill viruses, spores, fungi, literally within 30 seconds, that the patient is having a relief. It reduces pain. It gives them a soothing feeling. But you also know that that biofilm is being addressed. Next slide, please. This is a wound, one of the worst I've had to do, and it was a radiation burn, and it was a nasty fungating burn, and I landed up with this patient after many months of everybody having a dabble at it. And all I used on this wound was the Microdox gel. I would clean with it. It was very soothing for the patient. And then I would fill all the crevices with the gel, put Gelonette over it, and then dress it with a lot of gauze because it was a highly exudating wound. And you can see almost 4 months later how that wound had actually reduced down to what you're seeing there. And those black spots you're seeing there are charcoal, which the patient chose to apply to the wound themselves, just to try and help with the horrible smell, as you can well imagine. This was really a duty of love on my part, because some days when we started, I did the dressing twice daily, just to try and get rid of a lot of the exudate. Sadly, this patient did die months later, but at least she died without the nasty smell of a fungating wound and without all the pain that she had been in. Next slide, please. So another success story is a 58-year-old female, and sorry, that was the patient that you've just seen with the double mastectomy. I do have another patient, however. If we can go to the next slide. She was from Hawaii. She's an ex-South African lady, a very famous spiritual guru that lives on the Holy Mountain. And for 20 years plus, she had been diagnosed with Klebsiella pneumonia. And because she traveled internationally, this had a huge impact on the way she was able to perform, work. She always had to make sure she was at a center where there was good medical treatment. The doctors got to know her around the world. And the Microdox 60 really changed her life. And she was referred to me 2 years ago, and she arrived with, all I can say is, a casket full of methylene blue and every other kind of installation and irrigation you can imagine. And she wanted me to continue with this. And I had managed to speak to her doctor, and I got his permission to start using the Microdox 60. And her urine was really, really short. It was terribly offensive. So we decided to do it twice a day for 5 days, then once a day for a week. And I then taught her how to monitor her bladder. I taught her how to look at her urine for the little particles, look at the clarity of it, to smell her own urine, because she didn't always have urine sticks and, patients need to learn about their own bodies. This lady has now been bacteria-free for 2 years. She sends her blood off regularly. She is a bit of a treating herself kind of person, so she takes lots of other natural allopathic supplements, and she has done incredibly well. And in fact, she's just been here for 4 months, and she's stocked up with her product, and she's back home to the States to continue doing what she does. If we can go to the next slide. Well, there we go. So essentially, if we can empower our patients to understand their bodies, to understand what they need to look for, many, many patients can manage this themselves and they get some normality back into their lives. Thank you very much, everybody, for this opportunity, and happy treating your patients. And to any of the patients that are online, you're using the correct product, and just keep going. Bye-bye.
Allow me to make a comment just before we go to questions.
Absolutely.
As people with spinal cord injuries, quadriplegics and paraplegics especially, there's nothing cheap in our lifestyle. The word cheap doesn't exist. But I can assure you that this product costs less than a script and less than any antibiotic that you take. And it's now a responsibility of Quasas, I believe, to lobby and advocate for this type of product, Microdox 60 especially, to become part of a prescribed minimum benefit. And we'll make that an initiative of ours. Thank you.
Can I also make a comment before we go to the questions?
Absolutely. Thank you, Dr. Wilson.
Sister Mac, I don't advise any spinal patient to rely on urine dipsticks at all. It's actually in our bladder management recommendations, which were published in 2019 in the South African Medical Journal. We don't use dipsticks because the urine of every person with a neurogenic bladder disorder is abnormal. So rather you judge it by the color, if there's blood in the urine, if there's deposits, and by their physical symptoms. So those dipsticks are not worth it. There's one less cost for the patients. Thank you.
Thank you for that, and I will let the patients know as well.
Okay.
Thanks, Dr. V.
Pleasure.
Thank you, Dr. Wilson, and thank you, Beth. We really appreciate your contributions. That was absolutely fantastic. So before we go to the Q&A session, I would just like to mention that we will be sending out a mail to all of the attendees tomorrow morning with the details on how they can purchase Microdox 60. The product is NAPI coded for medical schemes and is available at Alpha Pharmacies, Dischem, Arinal, Mopani, Medipost online as well, directly through the New Angle shop at newangle.co.za. So I think we'll move over to the question session now. So I think there are a couple of questions that have been posted in the chat already. If I may answer the first one, did you purchase Microdox can you purchase it from any pharmacy, and do you need a prescription? Normally, what we would recommend is if you are a first-time user, it would be better to do it through your doctor, more especially if you are a paraplegic or a quadriplegic. And I think you can elaborate on that, Dr. Wilson, if you do agree with me or not.
Completely agree with you. It's ideal because I think you need the doctor possibly or a nursing colleague to explain how to use it, definitely.
Absolutely. So I think that's a very important thing to remember. It's always better to get it through your doctor first so that the doctor can manage you correctly. The other question is, can I use Microdox when I have a urostomy? So, Dr. Wilson, I will firstly ask you to comment on that.
I've never thought of it, to be honest. I don't see why not. I've never had that question, and I've never used it in a patient with a urostomy. Urostomy patients are relatively infrequent. So I think just to be 100% certain, you're under the care of a urologist, I would suggest you speak directly to your urologist. I don't think it will be a problem. I can't see why, but I strongly advise you talk to your urologist who did your urostomy.
I agree with you, Dr. Wilson. I think if you have a patient that does have a urostomy, remember urostomy is a piece of bowel that's been used to make kind of like a little bladder. So in that instance, sometimes patients might be sensitive to Microdox. So in that instance, you can actually use Microdacin as an instillation into the bladder. But I do fully agree with Dr. Wilson. It would be the best to consult with your urologist who would be able to advise you most effectively on that. There is a question with regards to UTI in sleeve catheters. If you could perhaps address that.
Okay, thank you, George, for this pertinent question. I had to look up exactly what sleeve catheters were because I confess I don't have many patients who use sleeve catheters. And a sleeve catheter is an elasticated fabric leg sleeve. And it's used, so it's not the catheter itself, it's used to comfortably support and secure a urinary leg bag or an external urinary sheath, i.e. a condom catheter for male incontinence. So you don't have a typical intermittent catheter or an indwelling catheter. So you would have to, I don't think you could use it if you don't have a means of accessing your urethra, because a sleeve catheter, the urine is draining freely. So I'm stumped on that one. I wouldn't know how to use it because you'd have to use an intermittent. I hope that answers your question, George.
I agree with you, Dr. Wilson. I think sleeve catheters, which I actually assume to be a Paul's tubing, as we know it earlier, if I'm correct in that regard, you would actually need to catheterize the patient in order to get the microdox into the bladder, because you do actually have two sphincters that the microdox needs to go to get into the bladder. So in that instance, most certainly you would need to catheterize the patient. So the next question is a lady that has asked that her husband has often got adverse effects when using Microdox in the bladder, as it gets very sensitive and it starts cramping within a couple of minutes. Definitely not irritating from their experience. So do you have any advice that you could perhaps offer them? You're on mute, Dr. Wilson.
Right. The co-host muted me.
Oh my word.
Okay.
Sorry about that.
That's okay. I can't now see the questions, but I can remember what the question was. My advice would be to definitely warm the microdox. Can I ask, New Angle, how would you advise doing that?
So, in actual fact, they can use like a bucket or a container with warm water in which they can place it to warm it up. Just ensure that when they warm it up, they take a little bit and they actually drip it on their wrist, because that's where you can normally feel if it's too warm for your wrist. If it feels the same as body temperature, you know it's the correct temperature before you can instill it. If it actually feels warmer than skin temperature, then you know that your microdox is too warm. So it's always very important to remember that you don't overheat it, because you can also cause burns in the bladder. So yes, I do agree with you, Dr. Wilson. If the patient does have a very sensitive bladder, it's always good to warm it up. I think I would like to ask your advice on this as well. I think also when you have a patient that initially uses Microdox, firstly, it needs to be done by a healthcare professional, most especially with the first installation. so that the healthcare professional can actually monitor the patient when they do the initial installation, number one. And also, if the patient does have quite a severe UTI, it's very important to remember that the bladder is quite angry, and there's quite a lot of inflammation. So, just to come back to what Dr. Wilson said is there's a lot of patients that actually use urinary alkalizers when they have UTIs, and they think that that will actually resolve the issue. But in actual fact, you raise the pH of your bladder to about 8 in that instance. And the pH of Microdox falls between 4.5 and 6.8, which is more to the normal pH of urine. So if you install Microdox into a bladder of a patient that is using a urinary alkalizer, you can most definitely elicit a stinging sensation or cramping in that patient. So what we would normally recommend is that that patient stops using the alkalizer for at least 3 days prior to using the Microdox, just to ensure that it flushes out of the system completely and that the bladder's pH returns to normal. I don't know if you agree with me, Dr. Wilson. Maybe you'd like to elaborate on that?
No, I think you've put it very succinctly, and I think doing it with your healthcare professional, nurse or doctor, is a very good piece of advice, definitely. And perhaps, I mean, if you can't immediately access your healthcare professional, try the warming and try using 10 mils. Don't do 30 mils, you know,
Yes.
bicky, slowly, slowly. Just do it very gently with a small amount of warm Microdox. But absolutely, your point about the citrus sodas of this world, definitely get rid of all of that. You want an acidic urine to start off with. Yeah, I agree with everything you have said.
Thank you very much, Dr. Wilson. We'll go to the next question. They say that the cost of Microdox is quite high and they've been struggling with discovery. So if I may answer that question, currently we are working with funders quite extensively to try and reduce the cost of Microdox. But obviously, the bigger the market grows, the more we can negotiate prices with pharmacies. So I do understand. Most patients do, however, get reimbursement from the medical aids, more especially if it's been prescribed by a medical doctor. Purely, I think if you purchase it directly, you might actually experience some issues with the funder. But as we said, it's a very good idea to always go to your medical professional, your doctor first, to try and get a prescription for it, and then maybe you can also get a motivation from the doctor to the funder to get it reimbursed. I don't know if you agree with that, Dr. Wilson.
Yes, absolutely. I think using a prescription gives you a much greater chance. And I see that Noel Smith commented further below that Discovery pays for his. So
Yes.
there is a way to do it, and your doctor must assist you and phone Discovery and just talk to a medical advisor and say, listen, if my patient uses Microdox on a regular basis, you're not going to have the cost of antibiotics. You're not going to have the potential cost of hospitalization for intravenous antibiotics. You're going to minimize the likelihood of bladder stones and kidney stones. So your long-term costs will be significantly reduced. And, you know, in the greater scheme of things, Microdox is not expensive in the greater scheme of things
Yes.
for when you
Most
consider
certainly.
other medical costs associated with neurogenic bladder dysfunction.
Yeah. I think if I can add something to what you said is the administration of antibiotics that raises quite a lot of cost to the patient and so forth, more especially if the patient has to be hospitalized. But also in addition to that, we also aim to try and really reduce the use of antibiotics so that we work with antimicrobial stewardships. Because of the resistance of antibiotics, as you mentioned, I think it's become quite a big problem. So we really want to reduce that. So I think in the end of the day, if your medical practitioner actually assists you in getting reimbursement from your medical aid, you will find far less frustration in that. So yes, I absolutely agree with everything that you said, Dr. Wilson. Thank you very much. We can move on to the next question, I think. Belinda Sampson says that I experienced shock-like reaction when using see-through cath. The yellow or the Foley never did this. Which do you prefer that will not do this?
I don't know what the see-through cath is, Belinda. I assume you are referring to a single-use catheter, because you can get catheters that are uncoated that you have to apply lubricant to, or catheters that come with a coating called hydrophilic catheters. So I think, Belinda, you need to source, and via New Angle, I can help you depending on where you live, a physical rehabilitation doctor who has a special interest in neurogenic bladder. I know lots of them all over the country now, who can guide you. So Belinda, please, New Angle can put you kind of indirectly in touch with me and let me help you, because that sounds strange, very strange.
Yes, absolutely. Thank you very much, Dr.
Sure, you're
Wilson.
not strange, Belinda. It's just happening.
Thank you
Okay.
very much, Dr. Wilson. Yeah, then Noel Smith says discovery pays for his. And then there's a question.
Yeah.
Good eve. I beg your pardon? Yes, good evening, and thank you for the informative talk. As an increase in catheter sediment concerning for imminent UTI, what would be the ideal Microdox bladder wash program in quadriplegic patient with suprapubic catheters? I'd leave that to answer to you, Dr. Wilson.
Okay. Yes, increasing sediment is a possible sign of an imminent UTI. In fact, just to explain that, because you have an indwelling catheter, a suprapubic, it's a foreign body in your bladder. So it sets up an inflammatory reaction, low-grade inflammatory reaction all the time. And the inside lining of your bladder is shedding cells all the time. And sometimes you might have more sediment and sometimes less sediment. So it doesn't necessarily mean an imminent UTI. It can fluctuate from time to time. So the ideal is, I think, as I proposed in my presentation, start immediately with 30 mils twice daily and do that for at least 3 days. And I think you should see your sediment reduce and change the catheter. Absolutely essential. Change the catheter, do the Microdox. Hope that
Thank you very
helps.
much. Thank you very much, Dr. Wilson. Yes, I think I absolutely agree with you. Microdox does, in actual fact, reduce bladder sediment to quite a great degree. So I fully agree with the statement that you have made. Thank you very much. They also want to know, is there a generic to Microdox 60 that may be more cost effective? Unfortunately, at this moment, no, there is no generic. Microdox is unique in its form. Unfortunately, there are no other products that relate in any way to Microdox. So be very careful what you install into your bladder. I don't know if you would agree with me, Dr. Wilson. The thing is, if you do have a sensitive bladder that does have an infection, that does have that little mucus layer on the inside that's broken down already as a result of an infection, and you may have a biofilm. By instilling something that has not been approved for bladder installation, you could actually worsen your condition quite a bit.
Agree. Absolutely. Don't use funny substances.
Besides headaches and sweating, what are some of the earliest signs of getting an UTI? I'll hand that over to you, Dr. Wilson.
Hello, Raven. Nice to see your name on the screen. Okay, so headaches and sweating are the commonest, but it's a variety of things. Remember, I mentioned you can get increased spasms, increased neuropathic pain. You can just feel pop and off. Something's kind of really vague, or you might get nausea, vomiting, fever, It's a variety of things. So you just got to be alert to your body and know what your normal is and just think, okay, what's going on? I don't feel quite right. Let me check my urine, let me change my catheter, let me increase my fluids. Start with that. So those are the earliest signs. It does vary from person to person, but I think the important thing is be sensitive and think about it. It's the number one cause for complications in spinal cord injury. So always think about a UTI.
Thank you very much, Dr. Wilson. I think the next two questions are actually quite similar in their relation. So as we go back to the previous question that was on sleeve catheter, I think you would have to consult with your medical practitioner on this, purely because you would have to be catheterized in order to have Microdox instilled into your bladder. I don't know if there's anything that you would like to add, Dr. Wilson.
No, I don't think so. I think we've covered that really. Yeah.
Okay. I think the next question from Kenneth is, if I don't want to start at the doctor to start using it, how can I use it as a quadriplegic using suprapubic catheter? I'm now using IV antibiotics because other antibiotics don't work anymore. I will leave that to you, Dr. Wilson.
Oh,
Definitely.
Kenneth, sounds like you've had a tough time. I don't know who changes your suprapubic for you, but really, if you haven't changed it since you got the infection, you really need to do it as soon as possible. And I think you need to follow the guidance about using a catheter tip syringe and instilling it, just as I said, into the catheter, leaving it for 15 minutes and then letting it drain out. So it's just as I explained. You don't have to go to the doctor to start using it. Your caregiver can do it if you're not able to do it yourself. And again, you could approach via New Angle to let me know where you are so I can guide you you can see in your area who might be helpful to you. I know that doctors cost a lot sometimes, particularly if you're not on a medical aid, if you're a state patient. So let's see if I can, through communication with New Angle, see if I can help you.
I agree. Thank you, Dr. Wilson. I definitely think, Kenneth, if you can, we will send an email out. If you can contact us at New Angle, then we will put you into contact with Dr. Wilson, and then Dr. Wilson can assist you with regards to getting to somebody who could assist you with that. Jason asks, do you have to use a new catheter syringe for each bladder wash? Should you decant Microdox, or do you draw it up from the bottle directly? Dr. Wilson, I'll ask you to answer first, and then I will elaborate on what you said.
Okay. So we usually prescribe a couple of catheter syringes per month, and you can quite happily wash them in soap and water, could even rinse them in a bit of Microdox as long as it's clean and dry. So you don't have to use a new catheter syringe. That does become expensive. I would definitely decant the Microdox. Don't draw directly from the bottle because you run the risk of contaminating. So have a little container that you know contains your 30 mils or your 50 mils or your 60 mils. So yeah, that's the answer to that one.
I absolutely agree with you, Dr. Wilson. Microdox is an antimicrobial, so it will definitely, if you wash your syringe properly and you keep it in the original packaging that you bought it in, normally you get the peel pack and you just open it a little bit after you've washed it and dried it, and you put it back in the peel pack. It's actually kind of like protecting your syringe so that you may use it a few times after that. They are asking if I think they mean Miss Potsit. Miss
Yeah.
Potsit.
No,
Yes.
no, it's an alkalizer. Alkalizer. Can't say that word. Okay, so no, it's like the citrus soda, throw it away.
Thank you, Dr. Wilson. Um, so they want to know what is the pH of normal saline solution, and the pH of normal saline is usually around 7. That is usually a pH neutral, so it's very close to what microdacin is in actual fact. The next question, as a quadriplegic with neurogenic bladder who uses Microdox twice a week, what do I do when the Microdox won't stay in the bladder for the full 15 minutes? It stays in for about 2 minutes and then it leaks out my urethra. I'll ask you to answer that, Dr. Wilson.
So I don't know if you're an intermittent catheter user or a suprapubic catheter user. It doesn't really make any difference. Ari, are you still here? Not sure. Okay.
I'm not sure if we've lost Ari.
Okay.
No, I'm here. I'm here.
Are you here?
Yes.
Ari, because you use an intermittent catheter, can you just explain how you keep the Microdox in your bladder for 10 to 15 minutes and don't let it leak out?
Oh, okay. So first of all, I use a brand new catheter each time. Just to go back a step, I put the catheter into the bottle of Microdox because it's absolutely sterile. I draw out into a reusable syringe, insert into my catheter, squirt the 30 to 40 to 50 mils, and it's all about how bad am I feeling as to how much I put in, and then I don't leak, so it stays in there, and then I catheterize myself after 15-20 minutes. So that's my routine.
Okay, so what I can comment is that's Ari's routine, but what you could do is you insert your intermittent catheter, put the syringe, instill the Microdox or send the Microdox into your bladder, but don't remove the syringe. Because if you move the syringe, that's when it may drain out. You agree, Ari?
Yes, correct. Sorry, forgot to mention, I empty my bladder first before I start that procedure.
Got it,
So my bladder
absolutely.
is
You've got to
empty.
have an empty bladder.
Yes,
And
yes.
it could be the same with the suprapubic. You don't
Yeah,
move the syringe.
what you're suggesting is just an easy, you're underwriting any leaking by keeping it in there. So it's easy peasy.
Okay, super. Thanks, Ari.
If I may comment on that, she says it stays and then starts leaking out of the urethra. So I'm not sure if you actually alluding to it leaking out the sides of the catheter. It might be that you're using a very small sized catheter. Sometimes if you use a very small sized catheter, you'll also get that it leaks past the sides of the catheter and out the urethra. I don't know if you agree, Dr. Wilson.
Yeah, I agree with that. Yep. So it does. Yeah.
Then there is, that would be great. Thanks, Doc. Good evening. I've been struggling with network apologies have been addressed. Okay, 100%. I think that has really addressed all of the questions. If there's anybody else that want to add anything, you may speak. Are you happy, Dr. Wilson?
Yes, I think I'm happy, and I'm happy to facilitate if people contact you to assist them.
Thank you very much.
Okay.
Sorry, may I make a comment, please?
Yes, you may.
Yes, sorry. I'm just responding to the person who inquired about the catheter bypassing. I have also experienced that on times, but I've found it is often related to when I have a couple of stones that come out at a similar time. And I don't know if perhaps a stone blocks the entrance to the catheter little hole and it's got nowhere to go and it bypasses. But I find that when I have those days, I withdraw out and then put a little bit in at a time, slowly, and I find it eventually stays in. But it only has occasionally happened to me.
Okay. My comment, thank you for talking about
Thank you,
it,
Joy.
Joy. My comment is, when did you last have a urodynamic study? Because you need your kidneys and your bladder checked very thoroughly for stones. Please do that.
Any further questions or comments?
A comment from me, Ari again, my last comment. Microdox 60, it's cheaper than a good bottle of wine and cheaper than a bad bottle of whiskey. It's a game changer.
Thank you,
No,
Ari.
definitely. Thank you very much, Ari. We really appreciate it. So everybody, for all your hard work and for taking part in the webinar.